this is Kim for Complete Balance. So today we're going to look at sciatica or piriformis syndrome. Sciatica tends to start from potentially compression in the lumbar spine. So the nerve actually comes out of the spine at L4-S1 area, travels into the buttocks, either goes underneath or through the piriformis, travels down the back of the thigh into the back of the knee where it splits into two. It then travels down into the heel and it splits again, and the nerve runs into each foot. So symptoms of sciatica are fairly well known. Numbness and tingling in and around or down the back of the leg, into the back of the knee and into the foot, or even numbness and tingling just in the toes. If you have numbness and tingling coming out of both hips down into both legs, then that's the time to go and see the GP. If that's a different condition, it is always best to get it checked out with the GP, particularly if you've got that loss of bowel or bladder function. So, how or why do we get piriformis syndrome? So piriformis syndrome or sciatica is generally because we have compressed the sciatic nerve. Now, the sciatic nerve is actually a very thick nerve, it's as thick as my middle finger. So it's quite easy to compress it, particularly if you have it as habit of sitting with your wallet in your back pocket of your trousers and then sitting, if you put your mobile phone and you sit on that. So it's always good that if you're going to sit down, then make sure that you've got anything in the back pockets removed. The other issue is generally driving, sitting still at a desk and not moving for long periods of time. That will also create symptoms of sciatica. So how can we treat it? Well, there is another video on YouTube where you can do it lying on the floor, but today I'm going to take it against a wall. Sometimes if the nerve is very irritated, this can feel a bit more comfortable because you're in control of the pressure that you apply. I've got 2 tennis balls knotted up inside a sock, and the balls are touching, so they're quite tight, so the knot wants to be quite close to the tennis balls itself with that sort of gap in the middle. And first of all, I'm going to take the balls sort of mid-thoracic, mid-back, and I'm just going to roll up and down. We want the spine to fall in the gap between the 2 tennis balls, and we're going to stimulate and soften and relax a particular muscle called the erectors. It's actually made up of 3 separate muscles. And I'm going to take this down. I'm going to working down towards the buttocks, which is generally bending and straightening the knees as I rock up and down. And the reason for this is to relieve any tension or compression that might be in and around the vertebrae. So and it's not too much pressure, it's about 10%. You're not leaning all the way into the wall, you're just putting a little bit of pressure either side. So you're working into the fascia, just mobilising and freeing up this area. Working all the way down. If you get to a point of tenderness and it feels a bit uncomfortable, you don't want to go 6 out of 10 in pain. And if it feels like a kind of relieving, gentle relieving pain, then stop there for a little while. If it feels so acute and so painful, take the balls above or below and then come back to it. And ideally you wouldn't sit on an area for anything longer than 30 seconds to a minute. Remembering that we don't want any acute pain. So now I'm coming down, I'm now actually onto the pelvis. I'm on the bones of the pelvis and I'm just coming up and over. So coming over the lip of the pelvis and then back onto the back of the pelvis. And up and down. And for the sake of the video, I'm actually running through this quite quickly. It might be more appropriate to take this quite slowly. Remembering the pressure is not too deep. You're not drilling for oil. You're not trying to go in too deep. There's a very fine line between sedation of an area or irritating it. The worst you're going to do is bruise. So it just might feel a bit tender. Good. So we're going to keep working down, all the way down. So I'm now the balls here. And almost to the point now I'm kind of in and around my tailbone. So you know the sacrum comes down like a point like that, and the tailbone comes underneath it. So I'm always at the sort of bottom edge of the buttocks. Good. And that whole little sequence could take at least a couple of minutes. Good. So then we're going to locate a bone called the Greater Trochanter. So if you bend the knee and just turn it inside and out, you'll feel the bone moving. So kind of know that's my start point. And then I'm going to take my fingers across, and now I'm looking for my sacrum, the bony edge of the sacrum, which is that inverted triangle. I'm going to take the 2 balls and I'm going to draw a line between this outside edge of the hip where I can feel things moving. And then I'm going to take the other ball into the sacrum. And then I'm going to put a little bit of pressure. So I'm treating the side for symptoms. So I've just come slightly side on to the wall that I'm using. And then I'm rolling up and down again. So rolling up and down. And generally this is where it will feel most tender. So again, bear with it. So you want to roll. So I kind of almost rolling on an angle. So I'm rolling on a diagonal. So I can feel the balls moving. So it's like I'm coming into a bit of a squat and then straightening my legs, coming into a bit of a squat and straightening my legs, rather than tipping forward with my shoulders. Good. And then I'm going to move the ball. And now I'm going to take the ball. So whereas before I was rolling like this, I now want to take the balls up and down the soft tissues, up and down the buttocks. So you want to find the top of the pelvis and then just pop the balls at that point. So they're just at the top of the pelvis and they're horizontal to the pelvis. And I'm just going to run up and down. And then we're going to move it. And we're looking for kind of those sore tender bits. And you might kind of think, oh yeah, that's a bit sore and tender. So it may feel like I don't want to move it because it's too sore and tender. But we haven't gone over that 6 out of 10. So just going to stay there, wait and hold. And what you might find is as you just wait and hold without putting more pressure in, you'll feel the balls or the tissue almost softening around it. So what happens is the balls sink through the superficial layers and they start to get into the deeper layers. So sometimes as you travel down to the deeper layers, the discomfort will become more uncomfortable, and then that's perfectly normal. And then you would only hold that position for maybe 30 seconds to a minute, and then just move away and then move the ball down again. And you could go back to going up and down, looking for those sore areas. Travelling down, looking for those slightly uncomfortable areas. And if you find somewhere that's a bit more uncomfortable, wait and hold. Again, you can have that visual representation, that picture in your mind of the tissues gently softening and just allowing the balls to sink in deeper and deeper, getting into those deeper layers. Good. So once you've done all the way down, so you cover this whole area, I like to then do this side of the sort of outside edge of the hip. So not the trouser seam side, just a little bit further side. So I'm kind of focusing on this area. So you can do this one of two ways. You can either take the two balls and come and lean in that way, or so you're basically coming into a sort of mobile, a moving squat. So bending the knees, travelling up and down, bending the knees, travelling up and down. And again, it's likely to feel a bit tender, and you might feel that the ball hits the bone or something quite hard on that side. That's absolutely fine. That's the Greater Trochanter, and it could be quite tender around there. So again, just waiting and holding, letting the balls soften, and then you can keep moving the balls down. So as you can see, you can just see the ball poking out through here. So that's one way of doing it, and you kind of want it almost work. Imagine you're going in a bit of a sunburst. You've got the bone in the middle, and then you're working all the way around the bone, and you'll get all of the hip attachments, including the piriformis, which is, as I said, one of the muscles that gets irritated. The other way of doing it is to turn the balls lengthways, come into just behind the trouser seam again, and then just turn that way. So if knees are a bit of an issue, you can turn this way. So you're turning through the shoulders as well as leaning into the walls. It depends on what feels good for you. If I'm doing that, I like to take my legs away from the wall a little bit. Can't quite see in the video, but it just helps me to lean in. So my legs are sloping away from the wall on a diagonal. Good. And you just do that a little bit more. Immobilizing and freeing up, that's what we're trying to do. We're trying to ease the tension. We're not looking to go very, very deep to bruise the muscle. And I'm going to come away. And then we're going to do that action. It's a bit of a, you're going to have the toes on the floor and the heels lifted. And then you're going to roll through the knees. So you're going to take the knee into the middle and then out, into the middle and then out. But you're going to do that with the balls behind you. So it's almost like you're trying to stub out a cigarette with your toes. So you're just taking the knee across the body, so this way, and then opening it that way. This way, and then that way. This way. And you might feel the piriformis and some of the other lateral hip rotators moving underneath the ball. So that's kind of the action you want to do. Knee going across the body, knee going away from the body. Good. Good. And just keep going through. Just pushing the ball into any position that you feel feels relieving. Moving it around. And then that will free up that whole area. Good. And then you step away. Shake the leg out to see how it feels. Come to standing. You might feel that the leg that you just worked on, that foot is making more contact with the floor. That's perfectly normal. It's because you've released a lot of tension in there. If you want to repeat on the other side, if you quickly want to whiz through that left pelvis hip area, then that's perfectly fine. Not going to do any damage. If you've got any questions, drop me an email. The email address is info@completebalance.co.uk. Great. I look forward to hearing from you soon. Bye.